We have around 6 lakh people who are homeless with mental health issues on the streets of India today. In Kolkata, where I work, the census has estimated around 69,000 people who are homeless. This, I'll say, is a very conservative estimate because people, who go out for doing the census will not step near people who have mental health issues.
So true.
Dr. Narayanan said, let us write a halfway home proposal.
Can you explain that term a little bit? What is a halfway home?
Halfway home is like, bringing in people from the streets and giving them a temporary place to rest and recover, a shelter. I actually wrote to our past president, Dr. APJ Abdul Kalam. So I said that I heard that you're coming to the city and we are working with a doubly marginalized people who are homeless and with mental illness. It would mean a lot for us. It would make a difference to these lives if you came and stood by us. Immediately he wrote back saying, I will come.
Wow. So Sarbani, you guys have achieved so much actually and contributed so much to Kolkata. What is the future? Where do you plan to take this entire thing? Hi, I am Ramji Valath from Azim Premji Foundation. In this show, we bring to you stories from the world of health. These are stories from the front line, stories of path-breaking work. So sit back and enjoy. This is the health worker. We all have our network of support. Family, friends, colleagues, who all reach out and help us when in need. Imagine a person who has lost this network completely. Someone with psychological challenges who's been cast out by their near and dear ones and who are absolutely without any support, literally on the streets. Someone who has lost all hope in life. I have a person with me who has dedicated her life to reaching out, supporting and rehabilitating these homeless people with psychological challenges. Sarbani Das Roy, an Ashoka Fellow, who is also the founder of Iswar Sankalpa. Welcome, Sarbani. Sarbani, did I get the pronunciation right?
Yes, you did.
I've really been practicing that,
Yes.
Bengali is such a sweet language and I should not be murdering it.
Yes.
So, Iswar Sankalpa is right?
Yes, perfect.
Thank you so much. You made my day.
We start on the right note.
So, let's start off directly with the kind of work you're doing. There are, I believe, 1 million homeless people in urban areas across the country. And out of that, about 1 lakh people, that's about 10%, suffer from mental wellness issues. Now, in my mind, this is a huge problem, right? What do you think is the size of this problem, and why is it an area where the government has to really step in and do a lot of work?
So, global statistics actually indicate that 35% of all homeless persons suffer from mental illness and or comorbid substance use issues.
My God. So that 10% is actually a huge understatement.
Yeah. And extrapolating from the 2011 census, that makes it 1.8 million who are homeless. Therefore, we have around 6 lakh people who are homeless with mental health issues on the streets of India today.
Wow. Okay. So that's a big number.
Perhaps it is this number which is causing a very daunting prospect in front of the government. How can we actually provide a care net for so many people with such acute problems? In Kolkata, where I work, the census has estimated around 69,000 people who are homeless. This, I'll say, is a very conservative estimate because people, who go out for doing the census will not step near people who have mental health issues.
So true. Yeah.
So actually, the enumeration is far less than what is actually happening on the streets.
So you're saying Kolkata alone has more than maybe 70,000 people with who are on the street.
Enumerated.
And out of that, about a third would be having some kind of mental issue.
Yes.
That's huge. So let me ask you this. You are from a completely different background. What is it that started you on a journey like this? You're like me, a marketing professional by studies, right?
Education.
Education. Both of us did our marketing and MBA in marketing. And then both of us seem to have found the right path in life. But yours is very powerful. So can you tell me what actually triggered this?
Yeah. So, I would just like to first say that homelessness is a journey of the mind, not only of the feet.
Okay.
So, there is a homeless part in many of us. And I think I became homeless when I lost my mother when I was just 5 years old. Yeah. I did have a shelter, I did have a house, but the metaphor of the home was not relevant anymore.
You had a house, not a home.
Yeah.
Yeah.
So, in ways, when she died, I was in Delhi at that time. And when I came back during my summer holidays, cognitively, I knew that she was not alive anymore. She was in the sky or something, they told me when I was small. But, I would keep searching for her. I would keep searching for that smell, that rustle of the sari. And, I would just feel that, if I turned round this corner, I would see her somewhere. So it was an unfinished story which has been haunting me throughout my life. And it's not that I don't know what death is. So as I went ahead in my life, there was this one, I did a lot. I did my management. Then I had 2 kids and I could not carry on with my corporate job. I took a career break. After nearly 6-7 years of a break, I thought I was losing my mind completely and I thought I needed to start doing something. And then I took up a course in psychological counseling in Shomikhoni in Kolkata.
So somewhere the seed might have been because of you are losing your mother early in childhood, I suppose, right?
It did. But it came back in a very strange way. And there I met Dr. K.L. Narayanan. And he was a psychiatrist who would help us in our course. He taught us. He was my mentor. So, like one day, both of us, and he became a very good friend of mine. So, both of us were one day walking on the streets of Kolkata. This was just opposite Mother House in Mother Teresa's house, home.
Yeah.
It was just opposite that in Beniapukur area. There is this big open vat. Now, we don't have open vats anymore, thankfully. But in front of that open vat, I saw this man eating from the garbage vat. He was a young man, probably 35, 36, and he was eating from the garbage vat. And it's not that I didn't see such a sight any time in my life. Like living in a city, I would see such people at all points of time, but it never struck me. Probably that day, it stood out. And, I asked Dr. Narayanan, why is this man eating from the vat? I mean, he could get food from the missionaries of charity.
Just across the road.
Yeah, and they give out food every day.
Yeah.
So then he explained that this was his dream. He wanted to help these people. These were the homeless people with severe mental illness.
Okay.
So I said, what do we do? So why can't he get food from the missionaries of charity? So he said that even if they come and give him food, he may not accept. Because of the symptoms of his illness, he could have paranoid symptoms. He would feel that food was not.
And they also might feel a little uncomfortable going to somebody who is like that and giving, right? And so it's both ways, I suppose.
There is a myth that people with mental illness are violent.
Are dangerous,
Are dangerous. They might hit out. So, people want to avoid that at any point of time. So I said, then what is going to happen to this man? So, he said he was a very a very renowned and a very experienced doctor. He looked at the man and he said he will probably die in another 15 days. So I said, how can he die? I mean, you can't die of mental illness unless you take your own life. So he said, no, he's going to die of dehydration.
My God.
And that in one moment, that sort of, struck me. I thought that here was this man who was going to die of dehydration and nobody knew who he was. And he would just become a numbered corpse in the morgue.
Yeah, completely. An anonymous corpse and nobody to claim, nobody to love him. Yeah.
But there could be a small child waiting for him back home, or his mother waiting for the son to come back home.
Yeah.
They would never know where he is and that he's no more in this world. That little child might be like me, waiting for him to come back. Just as, I just thought of myself in that place. And I thought maybe I would meet my mother someday like this. And this was another unfinished story. And I thought, we can't let these unfinished stories keep happening.
Yeah.
There has to be, and at this time and age, when India is sending satellites everywhere, a person can't just die of a treatable disease called schizophrenia just out of dehydration. And I said, Narayanan, we must do something. So he said, yes, this is what I want to do. This is my dream. So then we started thinking of how we could work with this problem. That's how I came into this work.
Your the first program that you rolled out. Oh, by the way, yeah, I don't think we should reach there first. So you decided that you should do something about it. Then what did you do? How did you actually, productionize this entire thought?
Okay. So then at that point of time, the only model of working with homeless people with mental illness was the Banyan model.
Yeah.
Where they had a halfway home. And, and we were all in awe of that piece of work that has happened, over the years.
Yeah.
And so Dr. Narayanan said, let us write a proposal.
Okay.
And so, he wrote a halfway home proposal. We wanted to do a halfway home where we would.
Can you explain that term a little bit? What is a halfway home?
Halfway home is like, bringing in people from the streets and, giving them a temporary place to rest and recover.
A shelter, basically.
A shelter. And then sending them back home.
Okay. So it's one step towards getting back home, basically.
So then we approached our funder. I was working in a funding agency at that point of time, and I approached my funder for a certain amount for the budget and the proposal, and I was rejected.
Oh, really?
So I was told that there is no way we can give that kind of money.
Okay.
So you have to think of, if you want to do this work, you have to think of something with 1/4 of that amount.
Okay.
So we came back. The only thing was that, I always think that there is never a no in my life. I always think that it is always that I have to change my approach. So we came back and we went back to the drawing board and I said, we have only defined resources as money. Let us define it other ways. So, okay, if I'm getting 1/4 of the amount as money, let us think on how we can raise resources from other means. And then we designed the community care model, because there was no way in which we could have a shelter or an institution, because that itself would have been a huge expenditure. So that is how we designed the community care center, where we actually tapped the resources of the community. We kept the person where he was on the streets, but we put our services out there on the street for him.
How did you do that exactly?
So we first we mapped the whole city of Kolkata, and we found out where we were getting homeless people with mental illness.
Okay.
So, on a particular street.
So you did a census, basically,
or
actual
it wasn't
survey.
A census, but it was actually a point-to-point survey which we did.
Okay.
And then when we found a person, we looked at what are the resources. So a person would need food, would need shelter, would need some kind of to protect him from the elements.
From the rains,
Rains, would need clothes, would need hygiene. So, and would need probably a friend.
Okay.
Yeah. So that is how we sort of tapped the resources. So if there was a mandir or a masjid nearby this person, we tapped that resources from where he could get food. And clothes and all other kinds of resources. The only thing we started looking out for persistently is a person whom we could tag him with. So in Kolkata, we love chai. And whether a person has roti 4 times or not, everyone will have chai. Yeah. So there will always be a chai wala in every corner of the city.
Okay.
So that's chai and football are the two things
absolutely.
in Kolkata, and we love that.
Yeah.
And adda, we call it adda because people love to talk on the street. They sit and they talk from everything.
So have a chai and talk about football.
Talk about football, politics, what not. So everything is done there. So actually we took help of this culture of Kolkata, and we sort of, tagged this person to a chaiwala who was nearest to the person.
Okay.
So, we would say, do you know this guy? Yeah, he's been living here. He's making things dirty, but he's okay. Like, he doesn't cause too much of nuisance.
Right.
So he said that, if we give you some medicine, will you give it to him when he comes for chai? First, he was not very receptive to it. He was feeling afraid.
Yeah.
So then Dr. Narayanan would give the prescription.
Right.
So he said, if anything happens, this is the prescription and I am responsible. So, that is how. So the doctor went to the patient. The patient didn't come to the doctor. We changed the equation of power.
Yeah.
The patient could walk away from the doctor if he wanted to.
Right.
There was no asylum where he would have to be bound and kept. So it was only based on the rapport that we build with him, and the love and the care which he understood. So that was the only thing. Now the caregiver would start giving him medicine and chai and biscuits, and we arranged for some food also.
Okay.
So all of that used to happen. And see, within 15-20 days, this person started getting better.
It was only the medication was actually required.
Medication
and somebody
was
to look
required.
after
And somebody to look after, somebody to talk to him.
Yeah.
And slowly when he became better, we started taking care of his hygiene.
Okay.
So he wore better clothes, he took his bath. So a new person emerged.
That must have been such a transformation,
And
isn't it?
yeah. And you know what? He started making eye contact with people, and the people in the community saw a new person. And they all became involved in this.
Oh, wow.
Yeah. And who took the onus? Who took the credit for the recovery? Guess what?
The chaiwala, obviously.
The chaiwala.
Yeah, absolutely.
And we gave him full credit because
Yes.
he's
a
making
hero,
the change
actually.
happen.
Yeah.
He is the hero.
Yeah.
And, that is what made a difference in everything. The fact that we gave credit where it belongs. We didn't say Iswar Sankalpa has done this. No.
Right.
It's the chaiwala who has done it. And slowly, what used to happen, we saw was that this man, when he became better, he also started working in the chai ka shop. So he would clean the battan, he would, help out the chaiwala, bring the water. Yeah. And because, no one likes to just keep on receiving. Everyone likes to give back.
So true. Yeah.
So a very spontaneous process of rehabilitation took place. It was not the, rehabilitation we do in these workshops where they learn sewing for years and nothing happens. But here this was happening. He was getting not very well paid, but he was getting the approval of his community. So his social recovery was faster than his clinical recovery.
Wow. Yeah.
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 So he was getting friends. He was getting acclaimed, that you're doing a fantastic
And he was
job.
doing productive work.
He was doing productive work. So he was again becoming a productive citizen of the city.
Wow. What a transformation.
So this is the model which, we started with. We still believe that social recovery and the client's will has to be at the center of all programs.
Okay.
Yeah.
Okay.
So that is the way.
So Naya Daur is what you named your first program, right? And that's such a unique program. I mean, using chaiwalas as a support system. What an innovative idea. And it is rightly said that, right, when resources are crunched, innovation comes. And such a brilliant innovation. But I guess it must have worked in places like Calcutta where you're saying there is a unique culture, right?
Yes, Calcutta is a place where there is people their lives are much more slow paced. And people notice, because there is a kind of ownership of the neighborhood also. So the ownership doesn't end with the flats
Right.
and the apartments only. It goes out, and we have a lot of horizontal slums also in Kolkata. So basically people just like to sit around, notice what is happening in the neighborhood, and call out if things are not right. There is also a para culture of relating to people and families as our own. So that's the thing. What is mine is extended beyond the family,
Right.
and neighborhood is also mine.
Such a lovely culture. Yeah?
Yes. And so, out of all the people who hang out in the evenings, in the mornings, read newspapers together, debate on politics, to football, to anything under the sun,
Yeah.
they also keep noticing if there is someone who needs help.
Right. Right.
So I think this a little slower pace of the city
Yeah.
makes it ideal for people to reach out and help people who are in need.
Your work started with one chaiwala. Then from there you must have scaled up to many chaiwalas, many wards. So can you tell me exactly how you scaled up this? And during that, of course, many more challenges would have emerged. So can you just tell us the journey of this entire thing?
Yeah. So, when we were working, we were treating people on the streets, and they were getting better. We had to also remember that we were treating women also on the streets.
Okay.
And when they started getting better, they also started getting more vulnerable,
Oh, yes.
because they started getting cleaner, and
Right.
there on the street, they became prey to a lot of abuse.
Mm-hmm.
And there was this one person who was staying in near the sale tax building in Beleghata, and her caregiver was telling me that, Didi, you please try and remove her from the street because it's not safe.
Mm-hmm.
She would sleep in the chaiwala's shop when he went back at night, and it was not safe. And I didn't have money at that point of time to just pick her up and
Yeah.
send her to some place where she could. And I said, just give me 5 days, I will use my personal resources to pick up. But I didn't get that time. Like the next day morning, I get a call that she had been gang raped and she died.
Oh my God, heartbreaking.
Yes. And sort of that defined my second challenge. And I knew that we could not keep on, leaving women on the street when they become better or when they agree to go to a shelter. But I didn't have the money to create a shelter at that point of time. This was
Right.
in 2008. So first thing I went to the police station to register a complaint. The response I got at that time was, Madam, you seem to be coming from a good family. Why don't you go and look after your family? I have better work to do now. A minister will be going and I will have to sort of look after the traffic.
Right.
So I said, okay, I'm going, but I'll come back again. So I went from there, I went straight to Lal Bazar police station. I went to meet the police commissioner.
Okay.
And I told him that, these are the kinds of things that are happening, and I want a space within one of your police stations.
Okay.
So he said that, are you mad? I mean, where are you coming from? Where are you coming from? I said that I am coming from this organization and I need a space in your police station. He said, why should I give it to you? I said, I'm dealing with homeless people with mental illness and I need a place for them to take, rest for a while, even if not for the night, at least for a while. And I want them to rest in your place so that your police force will know
Yeah.
that these are people who need care.
Right.
They are not lawbreakers.
Yeah. Yeah.
So that, you change the way you look at them.
The attitude towards them. Yeah.
Yeah. So he was like, he tried to shoo me off. So I went off. I came back the next day and I met him again. I showed him the 1987 Mental Health Act.
Okay.
In section 25, there is one line
Uh-huh.
which says that the police commissioner of the city is a guardian of homeless people with mental illness. The police commissioner at that time, he looked at me. He had never seen that piece of, that line or that document ever, because he thought he had no business with Mental Health Act.
Right.
So then he looked at me and he said, "What do you want?" So I said, "Give me a space." So he gave me a space in Hastings police station, where we opened our first daycare center.
What an achievement. Yeah.
So that was, that is how, and I immediately I realized that my strategy has to be to move into government spaces,
Yeah.
so that they cannot but acknowledge the existence of homeless people with mental illness.
Wow.
So that is the second thing. Third thing I did is I went to the mayor of Kolkata.
Mm-hmm.
I told him that I need a building. You have many spare buildings. I need one building where I can build a shelter.
Right.
Because I don't have money to build a shelter. I cannot rent also. You have to give me a shelter. Because these are also people under your jurisdiction and your care. I mean, you are the mayor of Kolkata. You have to give me a shelter. So he also laughed me off. They all laugh at me. Yeah? Like, what to do? I'm used to this. And I remember Azim Premji has once said, somewhere I read, that what are your dreams if people don't laugh at you?
And then there's no point having those dreams. Yeah.
So I have had many people laugh at me, and I love to remember those
It's a badge
incidents.
of honor.
Yeah. So then I kept on going to him, and my marketing style has always been to raise my nuisance value. So ultimately he got fed up, I think, and he gave me a shelter.
How many times did you visit him? For him to get
there's
paid?
no end to it. I would keep on visiting, and there were times when I used to call him on the phone also, and I used to tell him, "How come you're enjoying your evening when there are people who are dying out there on the streets
In your city.
in your city?"
Yeah.
So these are the things I would keep on doing, and then he finally gave me a shelter. So that was in 2010 when we had our first women's shelter. That was the first
2010 you said, huh?
2010,
Okay.
yeah. So, and in between, there was another challenge that I faced, is that I used to go to the, when I went to the government for help, which department would I go to? That was one of the things. So I went to the social welfare department,
Okay.
and I said, I want you to help me, to take care of these people because I don't have the resources.
Mm-hmm.
So, the person, the government official, he said that, see, because they are homeless, they are our responsibility. But, because they have mental health issues, you have to go to the health department.
The typical football.
So I went to the health department. And then they said, because they have mental health issues, you've come to the right place. But because they are homeless, we can't help you. Because, to get admission into any hospital, you have to say your father's name, your address, all of that, unless husband's name. If you can't say these things, you may as well not be a citizen of India. How can I help you? So I realized I was dealing with the nowhere people, and therefore their identity was one of the primary things I have to get.
Okay.
So slowly, these are the kinds of challenges that I faced, and as I went forward. Yeah.
So I know this story, so I'm going to sort of prompt you on this. When you're not getting enough support from the government, specifically the local politicians, etc., I think you used a Brahmastra and you invited somebody to come and visit you.
Yes.
So can you tell us about this Brahmastra?
So I didn't even realize it was a Brahmastra till it happened.
I mean, who would have thought something would actually work out?
But yeah, I kept inviting people because I had to visualize this invisible phenomena. People look at it, but they don't see it.
You don't want to acknowledge it, actually. Yeah.
And it was a complex phenomena. So I actually wrote to our past president, Dr. APJ Abdul Kalam. And I said that I heard that he was coming to the city.
Okay.
So I said that I heard that you're coming to the city, and we are working with a doubly marginalized people who are homeless and with mental illness. It would mean a lot for us. It would make a difference to these lives if you came and stood by us. Immediately he wrote back saying, I will come.
Wow.
I mean, I didn't know the impact this would create. I really didn't understand, I was so immersed in my own situation. I didn't realize, but I think this was what it was meant to be. So he came that day, and because he came, the government actually, they painted the whole place, they cleaned the whole area, and all the many ministers came. They were all standing there to receive him.
Suddenly you became the most visible person.
I became the most visible person,
and the organization
and
just
our
stood
people.
out.
Yeah. And then Dr. Kalam's car came, and all the ministers, they pushed me aside and they went to receive him. And then I saw that he is not coming. So then the minister said, Sarbani, please come. So, they made way for me. So I quietly went. Then Dr. Kalam was telling me, so you are Sarbani? I said, yes, sir. He said, then now I will come out because you have invited me. I was waiting for you.
What an amazing person.
And then as he came out, then, he was walking with me and he said, have these ministers ever come to your place? I said, no, sir. Then at least one thing is good that I have come. At least so many people have come and are now seeing
and
this.
And you got a free coat of painting also.
We got a free coat of painting. But that day, Dr. Kalam told people, all the guests who had assembled there, when you come to Iswar Sankalpa, there is only one thing which you should have in your mind. What can I give? So it was his What Can I Give foundation,
Yeah.
And he gave us 1 lakh rupees from his royalty.
Okay.
And that check, I honor that as a blessing throughout my life.
Yeah, I can imagine. Yes.
But what happened after that, none of the people who were present there has ever denied me anything that I've asked for these people. So whether it was the identity markers, anything, we have had the minister, the urban municipal minister, always beside us, who has helped us in every way. So the system has actually helped us since then.
That's fantastic.
And I'm really sometimes I really feel grateful for the kind of blessings that I've received from the universe.
It's also because of the persistence and perseverance that you have. I mean, so your 50% has been blessed by universe's 50%.
Yes, probably.
And so you said after that the system has helped you, and this is where I want to segue into the next question. You do now a lot of work along with the administration, right? Along with the government. Can you just explain what are the things that you've done together with the government?
Yeah. So I realized that, this trickle from the tap, that every day there will be so many homeless people walking into the city of Kolkata with mental illness, needs to stop somewhere.
Right.
So until the DMHP, District Mental Health Program, and the Indian Railways rise to this challenge, we will not be able to stop this trickle from coming into the city.
Yeah.
But what we can do is at least at the city level, try to stop people who are maybe on the verge of homelessness due to mental illness. So we can at least have some programs where the urban poor will be served so that they don't walk out.
So preventive program.
Program and curative also.
Curative and preventive, yeah.
So for that I approached the Kolkata Municipal Corporation again. And that in the beginning they said that mental health is not a municipal subject, we can't help you. Laughed at me again. And then with my persistence, again something changed, and they started a pilot program in 2 wards where we started this program. So the corporation gave us the infrastructure, the medicines. We gave them the professionals.
Okay.
And that is how this program started in 2 wards of Kolkata, in 2 units.
So this is along with the PHC, is it?
Yeah, along with the PHC.
Okay.
So it was their infrastructure, the primary healthcare infrastructure, which was anyway serving the health needs of the area around it. Yeah. So now it was also serving mental health.
Right.
Yeah. So in that way, the stigma of being mentally ill also sort of reduced.
Yeah.
Because you're going to the same place. You're not going to a mental health institution.
Oh yes, absolutely. Yeah.
So like this, slowly it became so popular and in demand that corporation, actually we have signed the 4th MOU this year.
Okay.
So, and we've served nearly 7,000 people. So I would like to think that at least 7,000 people will not become homeless now due to mental illness. They will not walk away.
Huge thing, yeah.
So yeah. And this is something which the government, the Kolkata Municipal Corporation is now actually willing to take up more responsibility and take it forward. So beside this, with the government, we've also worked in the vagrants' homes, where
Okay.
there are huge numbers of people who have been staying there, and they have become like, they've been just staying there lost forever.
Right.
There is hardly any effort to send them home or give them a purpose in life, which is very important for, the way we work. Giving each person a purpose in life is something we started working with the government. We've sent our teams, they have adopted our SOPs, and now we are working with sending people home from the vagrants' homes, so that, uh,
So there are also people with some level of mental disability,
yes,
is it?
yes, yes.
Okay. Okay.
So as I said, 35% of all homeless people will
Right.
have some kind of mental health issue. And if you are locked up in an institution for 30 years
Yeah.
with hardly any kind of stimulation in your
No
environment,
stimulation, no compassion, no support.
nothing. So
Yeah.
it's very difficult, it's a very difficult life. But the government has now opened up to taking this forward, taking all these experimentations. They have trained their staff. We've gone there and trained their staff, and we are making some progress. And this is what I would like to see in the future, a lot more.
Yeah, because once the government really gets into the act, the multiplier effect is so much more.
Yes, we have an extremely compassionate social welfare minister who is actually very open to taking such
That's so wonderful
steps.
to know.
Yeah.
Now, I just want to go back to your model. What I understand is what started as work on the streets, then went to the shelters, and from there, I believe you also have integration into normal life for all these people. Can you just explain that model to us and how you built it one by one?
Okay. So when people came into the shelters, the first activity that we actually started was activities of daily living. So,
Okay.
having lived on the streets for a long time, they lose the control of their limbs, their muscles, and due to prolonged malnutrition, there is a lot of physical sort of weakness which people go through. So we give them time to actually get back their strength and their stamina physically. Slowly we start looking at them and trying to understand where their interests lies.
Okay.
So we offered them certain kinds of work which is available in the shelter. For example, they could be doing sewing. There is craft things which they could be doing, like decoupage and other kinds of fabric printing, this, that. All of these, art and craft, pieces are there for them to choose
Okay.
what they want to do. Along with this, we also start a functional literacy program
What
where
does that mean?
functional literacy is, for example, what they do is they need to know if they want to count notes, what is the denomination of the
Okay.
note.
Yeah.
And what is the number of the bus that they would like to go ahead, what are the kind of landmarks around the city.
Right.
So slowly, they start getting used to, because many of them come from different states of India.
Oh, yes.
So getting all of this on a common platform
Yeah.
is one kind of a challenge. So we do this. Then slowly we decided that this leads to some kind of a stipend. It's a vocational but it's not enough to actually help them get back on their feet.
Okay.
So we asked them, we found out from them what is it that they would like to do. And like one of them said that, Didi, can you help us to work on the land, because that is what we've been doing from when we were small.
Right.
So most of them come from the rural parts of India.
Yeah.
And so we brought a piece of land in a suburbs,
Okay.
and there we have built a center where people who have got better, but they will never be able to go back home, so that they can find their roots in this small place which can be nearest to their home.
Okay.
Because the earth, Mother Earth, actually never rejects.
Yeah.
So there is always something which they are, agriculture, farming, animal rearing, that is what they do. And they live a, codependent, interdependent community life, not exactly enclosed in shelters.
Right.
So that is happening there. Besides that, what we have already started is, we've started a bakery.
Okay.
And we've been training people from 2018. We have been training them in bakery skills, and the products are sold in the name of Crust and Core.
Okay.
So we have a small cafe where we sell them, and we also do it on Swiggy, Zomato, and all of that.
Wow.
The reason why we decided that we will have a cafe is that so that so-called normal people can walk into the cafe, eat a piece of cake served by a person with psychosocial disability, and know that this person is not going to be violent. This person can serve. Not only that, when that cake is tasted, it can taste as good as a cake in another confectionery.
Yes.
So the fact that production and success can be measured, in different ways.
Yeah.
That is what I've tried to, highlight, and that, and it has worked. It's been working. So basically, our work is to show them in a light of familiarity. They are not only people who will sue in the background. They are people who can come to the forefront if they need to. They are people who can go out and work as in factories, in other bakeries. People who have been trained in our bakery, they are going out and working in home bakeries and other places.
Okay.
So all of this is giving them an adequate income for actually something. And then when they go back home, what I've seen is that, many of them, there are some bakeries in their own neighborhood where they've started baking bread, or sometimes even cakes, this, that, in their community, which earns them a lot of,
respect and love.
Respect and love.
Yeah.
So all of that is actually helping them to get back the respect that they had lost on the streets of Kolkata.
So they're getting agency, they're getting respect.
Yeah.
So many of them have become productive, one you said, and many of them have been integrated back into their families, I suppose, right? So for all these people, there is now hope, there is self-confidence, there is ability to become a productive citizen and being back with their loved ones.
Exactly.
Some kind of community which is happening. Wonderful. So can you tell us the story of a couple of these people who have gone through this cycle?
Sure. Abdullah was a person whom we met, we found in Khidirpur. When we saw him, he was sitting in a garbage dump, and he was with his hands folded, and he was, as if in prayer, like reading the namaz. So we brought him to the camp. We were having a camp over there. We brought him to the camp, and there we found a shopkeeper called Nihal. So he was not a chaiwala, he was a shopkeeper.
Okay.
So he started taking care of Abdullah.
Okay.
So Abdullah would sit in his shop, and he would give the medicine, and in the night he would sleep in Nihal's shop. Slowly, once when I had gone, I saw that Abdullah was actually reading a newspaper.
Okay.
And I saw it was an English newspaper.
Oh, okay.
Slowly we started asking him, talking to him, finding out, and as he recovered, we came to know that he was a radiologist, a technician in Nanavati Hospital.
Okay.
And we tried to find more details, but he would not give any more details. So, in ways, sometimes the homeless person doesn't want to give details regarding home, and we respected his privacy. So we didn't probe further, but he stayed on. He became better. He helped, Nihal in his shop, and they were like brothers. A very interesting, conversation I overheard. So Nihal once told him, Abdullah, then we came to know that his name was Suresh Kamble.
Oh, I see. Okay.
We came to know because we got some information that his name was Suresh Kamble.
Okay.
So then Nihal said, Abdullah, it's fine that you want to stay with me. I'm not sending you anywhere.
Yeah.
But what happens when you are no more in this world?
Right.
So, shall we bury you or shall we do cremation for you?
Okay.
Because, the religion was quite... So, I still remember the answer that Abdullah gave. Abdullah said, Nihal bhai, this is my second birth. You have given birth to me by your care and your love.
Oh my God.
Your religion is my religion. And sort of, that shook me, that this is what religion is. Love is religion.
Yeah, so true.
It's not dogmas and things like that, it's love.
Yeah.
And I still, I get goosebumps when I think of that answer. And Nihal was, looking totally flabbergasted. He said, but, we can't do this, we can't do this. He kept telling me, Didi, but we can't do this. I said, okay, let it be. He's just sharing what he's feeling at this point. Let's respect that. We'll see what to do afterwards. So, and then once I had been invited to Kaun Banega Crorepati, and I took Abdullah with me.
Okay.
So he flew with me in a plane, and we went and KBC
with
Amitabh Bachchan, and they really took care of us. And I still remember. So on that day, we were all standing there, and on that stage, even Ayushman Khurrana was there, and Amitabh ji and all of that, and Abdullah was also there. So we had this beautiful program we had that day, and Amitabh ji was very thankful to Abdullah for sharing his story. What happened, that episode was telecast nationally. His family actually saw it.
Oh.
His son's wife saw it.
Okay.
But she didn't know Abdullah, because she had never seen, because Abdullah left home when she was not there.
Before she got married. Yeah.
So then slowly at some point of time, there were some connections through her only we could make. And then the family came and they took him home. So then his daughter-in-law saw, I saw you, Papa, I saw you on the television, but I could not understand it was you. So now he is back home. After he went away, Nihal's health suffered.
Oh.
And Nihal kept saying, I've lost my brother, he's gone. And Nihal passed away. But even before passing away, he made sure that Abdullah was taken care of by his family.
He's another hero, right?
Nihal is the hero.
Yeah, absolutely.
So I always say, all my caregivers, they are the heroes. We have hundreds and thousands of heroes in Kolkata.
Oh, amazing. Yeah. I got tears coming in my eyes. So seriously,
yes.
Very powerful story. So Sarbani, you guys have achieved so much actually and contributed so much to Kolkata. What is the future? Where do you plan to take this entire thing?
The future, I would like to see Iswar Sankalpa becoming more and more redundant.
Okay.
I would like to see government systems empowered to take over this responsibility of citizens of Kolkata, citizens of India, into their health systems, into their social work systems, and give them a reasonable life of respect and dignity.
Right.
In order to do that, we still have some work left to do, and in the next few years, Iswar Sankalpa will go about trying to work with the government and strengthening those systems, trying to strengthen the Kolkata municipal corporation systems so that this work can go on. And besides that, I would still like to say that, we feel very awed with the numbers that we've reached. Okay, 7,000, 8,000, maybe 25,000. But it's not just numbers for us. It's like a family member. And, we still have a long-term kind of responsibility towards each person whose lives we have touched. We try and keep in touch with them. There is so much work still left, and we would like to go more in depth, and depth of the whole, issues, and look further how we can enrich their lives. So, yeah.
Fantastic. So, you're absolutely right. So, the moment it is institutionalized within the government, it'll start with Calcutta, and then I'm sure it'll then spread to the rest of West Bengal. From there, it can spread to the rest of the country. So it's a huge multiplier effect which will have. And again, I keep going back to what started with that one chaiwala can actually change the entire country. Thank you so much, Sarbani. I think this is the most amazing episode. It's really made me very, very emotional. Thank you. Over 3,500 homeless with mental health challenges supported through community outreach. Over 600 of these people reunited with their families. Over 7,000 people from urban slums treated for mental health. Over 800 homeless with mental health challenges given shelter. So we talked about a lot of numbers. 7,000 numbers, 600 numbers, 800 numbers. What we need to remember is that behind each of these numbers is a human life. A person who had lost all hope in life, whose life has been completely transformed. And that's exactly why Sarbani's life and Iswar Sankalpa's work is truly amazing. I hope people watch this video and it ignites their mind to follow the same path. I'm Ramji Walad from Azim Remji Foundation, and this is The Health Worker.